Okay, now a question from a client came to explain a little bit the dangers of thrombosis. Now, what is thrombosis? Thrombosis is appearance of coagulums, when blood coagulates, usually in our veins. Other name for it is a deep vein thrombosis. Our blood normally should coagulate only when we are bleeding. It should not be coagulating while it is flowing through our blood vessels, arteries or veins, doesn't matter. Now, when we are talking about this coagulation of the blood, there are sometimes we call them diseases, where, let's say, the number of platelets that assist in blood coagulation is increasing, is very high. Mostly, we see the problem of thrombosis occurring in older people. But now, of course, all the so-called diseases of elderly are being pushed into younger and younger generation. The symptoms that thrombosis of veins can cause is swelling, tenderness, leg pain, even cramping, change of skin color, because there is a problem with blood flow. Leg may become warm. Stagnant blood flow is going to create problem of oxygenation also, which causes the pain. Before we can dive deeper into the cause of this, we can just look at first causes. What causes it? Well, it could be caused by injury from either the accident, or you hit yourself, or surgical procedure. But also certain medications can become problematic. Well, in my opinion, all medication. Because the risk factor is age. Why age? Is number one. People which are over 60 are more prone to this problem. Well, what do we know about age? Because of the wrong scientific information, actually correct scientific information, which is opposite to scientific truth, we presume that older we are, the more toxic we are, which basically is the norm, but it is, as every other law, it has exceptions. Because age is not a problem. What is a problem? When we age, our blood becomes thicker. Thicker means dehydrated. When blood is dehydrated, it's not polycythemia. Polycythemia does not exist. It is just level of dehydration. Less lymph, less plasma you have, the more dense blood will be with cells. So less hydrated blood has problem of cleansing, becomes more toxic. So here we go again, toxic blood. Lack of movement. Well, lack of movement just makes it a little worse because it causes stagnation. Sedimentation is easier. But what do we see in people that suffer from thrombosis of veins? They often, their legs become blue. Their veins are blue. They are varicose. Now, what causes varicose veins? Again, it's toxic blood as a primary factor. But because of this, we go into cellular dehydration. Because cells tighten membranes, the more toxicity they sense, the tighter are the membranes. Less plasma goes in and out of the cell. Cell doesn't want to accept it. So hydration becomes problematic and cells will start dehydrating. Tissues formed of dehydrated cells becomes brittle. So blood vessels, when they are made out of dehydrated cells, become brittle and they shrink in size. Veins have valves. They don't allow blood seep backward. But the dehydrated valve loses tension, so it collapses. Not all the valves will be affected equally. So there may be some that are still holding, some are collapsing, and you have stagnated blood in between. Tough to push. Well, this is where you can expect thromb occurring, coagulation occurring. Lack of movement makes it that much more problematic because it's a much slower flow, much easier to remain longer time in a position and sediment. They say pregnancy also makes it worse. Well, why? We are talking of higher toxicity in the body of pregnant woman. And things should get better afterwards, but there is a still period of time after a woman gives birth when she will be detoxifying. And when we detoxify, it's not only the blood, it is from the tissue. Toxins are coming into the blood. So during the detox process, the blood at one point gets more toxic, has to be flushed. And if we are lacking of plasma, this is not happening. So the toxins stagnate, causing problems. Birth control, again, hormones. When we artificially implement hormones in a body, the body has to deal with them. They are causing actually toxic overload. They become toxic, increasing the possibility of coagulum occurring. Smoking, this goes without any questions, any toxic material. Smoking is not only the nicotine, it is all the crap that they put in the cigarettes to make them addictive. But so does alcohol, so does garlic. Okay, so all these things are toxic. They say inflammatory bowel syndrome or diseases. Well, these are just symptoms of toxic blood and toxic tissue. So it is very easy to see by risk factors that we are talking about toxic blood and toxicity overall. Now, complications. The coagulum may dislodge, start flowing, and the returning blood from the body, when it hits the heart, first from atrium is being pushed into lungs for oxygenation. And if you have a coagulum there, thromb, it may get stuck in one of the small arteries as it's flowing, because even though it's venous blood, becomes, it becomes arterial blood when it's pushed from heart to the lungs. And if coagulum is there, as the blood vessels narrow from larger to smaller and smaller and smaller artery, well, the coagulum may be stuck in one of the small arteries and then prevents oxygenation of the area. We get thrombosis of lungs. People are told very often, oh, you have a thick blood, we have to give you stuff to dilute the blood. So they give you aspirin or some other new drug for dealing with the problem, but what they're actually doing, they're not diluting the blood. The only way to dilute blood is to put more lympha in it, to put more plasma in it. This was diluting the blood. What actually doctors are doing, they are putting anticoagulant to prevent coagulation, thinking that this will prevent thrombosis to occur. There will not be coagulation and formation of thromb. But this actually is going to create more problems, because they say, well, this is going to protect your heart. Well, the thromb that is coming from the body is going to be lodged somewhere in the lungs before it will be lodged in the heart, because from if you can go through the arteries and go back into the venous oxygenated system, back into the heart, well, it's almost no possibility that thromb is going to pass through. It's going to be caught there. And if it can pass through there, it can pass through our heart arteries as well. It's no big deal. So it's very, very small risk of getting heart stroke from thrombosis. But what do we see in people that have thick blood? That when heart is pumping, it sends cluster of cells. Blood doesn't flow. It's like cluster of cells pumping. They're banging one into another. Not only they are banging one into the other, they are banging into the walls of arteries. And here is a problem that may cause coagulation. In my opinion, this is not real cause. What do we know is that body is polarized. And the blood vessel, if it is positive on the inside, it will be negative on the outside. Everything that flows in a blood has to be positively charged. If not, it is going to adhere to a blood vessel. Positive and negative attract. So everything in a blood also carries positive charge. Now, yes, there are negative ions, but they are in a form of salt, which means they bond to positive ions. So they are not being left as a negative ions shooting around. Only positive can flow. Now, lower is the voltage in the blood or in a tissue, let's say artery, the electromagnetic field around it is weaker. Weak electromagnetic field causes very low repulsion. We know that positive and positive repulse. So the lower magnetic field, the closer particle gets. And then with little push, bam, they simply cannot avoid hitting each other. Cells in the body, in the blood as well, they become more brittle when dehydrated. And they will get dehydrated because blood is toxic. They will not hydrate. They will tighten the membrane. So the problem actually is of electric nature. Why electricity doesn't flow well through thick blood? Because there is not enough conductive area. The reason why blood is not water is because water does not conduce electricity. It is actually electric isolator. And to make it conductive, you have to put ions in it. The ions are minerals, which we receive through salt. So it's absolutely crucial for us to have a good amount of salt, because we lose the salt every time you urinate. You are not urinating water, you are urinating plasma, water with minerals. When you sweat, same thing happens. When you defecate, when you cry, same thing happens. You are always losing plasma, which means you are always losing minerals. You have to keep replenishing them. But if you are on vegetable diet, plants are very poor with minerals. You don't replenish them. This is why herbivores have to be given salt. They lick salt because there is not enough minerals in the plants they eat. What are we being told by science? That we cannot get mineralized having salt because it's inorganic. It has to be put in organic form, chelated through plants. It's a bullshit science. Science, as I call it. Perfect science. So, doctors want to help, but they are using science. There is no way they can help, because we are being scientifically indoctrinated. How can you prevent this? How can you prevent thrombosis? Dilute the blood, number one. Make it more electroconductive. How do you do that? Well, it's definitely not by taking anticoagulants. They will do actually just the opposite. But you introduce salt and water in a form of plasma. Now, what is the danger of doctors' interventions through anticoagulant? That, okay, you will prevent or minimize formation of thromb because you simply do not allow the coagulation to occur. But you have a body that has dry, very fragile blood vessels. Somebody squeezes you a little bit harder and bingo, some of these blood vessels break down and you have uncontrolled seepage of blood. It cannot coagulate because you are on anticoagulants, and you start having big mark, greenish, yellowish mark. of blood just seeping out there and then breaking down. You are very prone to injuries. And now just imagine you have these anticoagulants, and fortunately we don't have many arteries in the brain because brain is being fed through lymph from meninges. But even so, there are some arteries, few, that go in the brain. And what happens? They are same. Well, usually they are in better shape than arteries in the body because of, maybe even that's not the truth, because those arteries did not go through meninges. Okay, just small arteries that go in and take red blood into the brain, but there are few of them. And let's say you step hard. You miss a step and you just have that toe. Well, if your arteries are dehydrated and fragile, and brain is mushy, brain is suspended, so it doesn't have hard hits, so it floats, it absorbs shock, but it moves. And this movement may cause a little pull on the fragile artery and poof, it breaks. In normal circumstances, not a big deal. It's a very small artery, so it is going to, very small amount of blood can come out, and as soon as blood comes from positive area inside of the artery, outside, which is now negatively charged area, well, electromagnetically it will bond and starting preventing further exit of the blood, causing coagulum. Well, when you are in a situation, elderly, very toxic, low energy, low voltage, magnetic field is very low, so blood is going to come seeping. It is not bonding too much, it's just flowing through, and it will cause tamponade. Tamponade prevents oxygenation, and you get a stroke. Majority strokes in elderly people happens because they are medicated with anticoagulants. They say 1 aspirin a day saves your life. Baloney. It's the opposite. Again, doctors are following science because this is how we are indoctrinated in medical school. So, yes, thrombosis could be very dangerous, mostly for pulmonary thrombosis. But also, what is dangerous is the state of the body that causes thrombosis. This is the real danger. Which means we have to address the health in general, introduce more plasma into the body, dilute the blood so it is more electroconductive, so voltage, even if it is lower, can flow easily, which will increase the electromagnetic field as well. So it's, should people with a thrombosis be medicated? Well, the thromb is going to dissolve itself as soon as we do the right thing. We increase our plasma levels and hopefully stop poisoning the body with incorrect food and medications. What is the most common medication, or medications, because now it's multiple of those, that people take before even they get into the situation? Is blood pressure medication, starting from diuretics to expel from the blood as much plasma as possible, because a lower amount of blood will decrease the pressure. Normally, if you have a hose half full of water, it's going to be mushy. If you fill it in correctly, it's going to be hard. If you increase the pressure of the water, it gets stiff. Well, our arteries should always be properly filled with blood, but they are not. We are all being dehydrated because of our habits, because of the science we follow. And this is why we become more toxic. This is why all the problems occur. So we have to reverse them. How do you reverse science? With science. So whatever science tells you to do, you do the opposite. When they tell you, no salt, double on salt. But again, has to be the right salt. Has to be not refined sea salt. Not salt from a mine. Some mine salts are very good, but they are not adequate to sea salt. So we have to hydrate. And then minimize poisoning yourself, because when you hydrate, your blood is going to start cleansing, and your tissue even will start cleansing, but your cells will not start hydrating until the blood is clean. And once when the tissue is cleaner and blood is sufficiently clean that the cellular receptor decides, okay, I'm calibrated, this amount of toxicity is permissible, and it will start opening the membranes and start actually hydrating using the osmotic pump, producing potassium. This is when healing starts. But even then, cells absorb a little bit of plasma and right away find opportunity. They work like the body. Little plasma, oh, I can get rid of these most problematic things. Choop, throws them. Where does the poison from the cell go? In the blood, making the blood more toxic. So the detox process, the true detox process, I'm not talking about the medicinal detox, like shamans do, or like we are being told, well, drink lemon with honey and, I don't know, vinegar. This is only stimulating body to quicker eliminate toxins from a blood and whatever it can reach from a tissue at that moment. But the cells close down further because the stuff is toxic. And after you eliminate these things, then the cells start opening membranes and garbage starts coming out from the cells. Then in a month or two, your blood is almost as toxic as it was before the cleanse. When we are talking about true cleansing, using self-healers protocol, well, you are cleansing tissue, cells, and the blood. And this process is a lengthy process. You feel improvements on spurts. You don't know toxicity when it's in a tissue or in a cell. You just become aware of it when it's in the blood, because this is when it causes problems. So when you deal with a body that has thrombosis, that has a problem with the circulation, and there are coagulums there, well, it will dissolve them. But you have to help the body hydrating it. So if you are in really bad situation, you can maybe use a little bit of anticoagulant, but you have to start increasing the plasma. But here is a problem. If you take anticoagulant and you are increasing the blood plasma, you are going to be increasing blood pressure because the blood vessels are not flexible, they are dry and they are brittle. So being dry, they don't expand, they lose flexibility, and as heart increases the pressure, they don't dilate, and pressure within artery rises. If that happens and you have a brittle arteries, well, the small arteries are the weakest ones. And, they may be bursting. They may be cracking. And if you have anticoagulant, you are not going to prevent escape of the blood into the tissue or coagulating in the tissue, preventing more seepage of the blood. So anticoagulant is always problematic stuff. Don't use it. You have to hydrate, because if there is no anticoagulant and you are hydrating, you are increasing, even blood pressure is increasing. And even if the arteries start cracking, well, usually if they crack, it's only around the heart, because this is where the highest blood pressure is. But then, as soon as the crack opens, the negative part of the artery is being exposed and causes adhesion, formation of a protective layer. And unfortunately, we relate this into a cholesterol problem, closing arteries and preventing circulation. Well, this happens only if you ignore the problem. But if you continue with the protocol and do things correctly, then as you hydrate slowly cells and cleanse them, they regain their strength, their elasticity, and the electromagnetic polarity increases, which means electromagnetic force increases, and coagulum will be popped out, will be dissolved basically, and particles will be not allowed to stick again to the blood vessel. And this will be end of problems, which we are told, no, it's caused by cholesterol. It's not caused by cholesterol. Cholesterol is the savior here. With other particles, it basically blocks the seepage. But then it continues accumulating as other cracks are happening around the same area because of brittle arteries. Knowing the truth, knowing how the things work is going to save us. Unfortunately, doctors are not being correctly educated. They have been indoctrinated to do the dark deeds of cabal. And this is why they cause more problems than they resolve. They are only good for emergency cases when they are normalizing things. But healing, they have no clue. They have no clue because they have no clue how the problem occurs, what actually causes it. Everybody blames inflammation. Not true. Inflammation is part of the solution, not part of creation of the problem. But about this, I have another video. Okay, so if you have a problem with thrombosis, you have to start doing everything opposite to what you are doing. And do everything contrary to what doctor tells you. You'll be just right. Stop eating vegetables that are poisoning you. Go to meat diet. Don't cook the meat. Eat it raw. This is the healthiest food, easiest to digest. And hydrate with plasma. Put as much salt as you like, but has to be sea salt, on your meat when you eat it, and drink plasma. Don't drink water. Always put some salt in it. Again, sea salt. You will help your body to heal. Hydrate, cleanse, and heal. Thank you for listening. Till next time, love you all. Namaste. God bless you.